I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. When you think of men's health, this might come to mind. But that's not what we're talking about today. In honor of Men's Health Month, we're raising awareness about the gap in the number of men seeking routine care. Studies show that men are significantly less likely than women to go to the doctor for an annual checkup. And that's troubling considering that men have a shorter life expectancy than women. They're also more likely to die from chronic diseases, including heart disease and cancer. So today we're exploring ways that men can take positive steps for their own health. Joining us first to discuss men's health barriers and risk is Dr. Scott Hetzel, an internal medicine physician with ThedaCare. Dr. Hetzel, thanks for being with us.
Yeah, thank you for having me.
To get us started here, what are some of the maybe biggest health risks that men are facing?
Obesity, it's kind of an epidemic, and the chronic disease that come from obesity, high blood pressure, high cholesterol, diabetes, sleep apnea, and then cancers. And if you smoke, you're at risk for COPD, chronic obstructive pulmonary disease. That's kind of a lot of things that we see in the clinic.
What about mental health? Are men at a greater risk when it comes to mental health concerns?
Generalized anxiety disorder, depression are super prevalent in the patient population that we see, whether it's men or women. But I think men in general have a harder time coming to the doctor with their mental health. And it's super important because it puts them at a higher risk for suicide. And so trying to deal with it on your own is not the most beneficial way to go about it.
All right, Dr. Hetzel, these are all really good things for getting us into men's health. Joining us next to talk about specialty care for men is Dr. Andy Mays, a urologist with ThedaCare. Dr. Mays, thanks for being with us.
Thanks for having me.
So to start off with, can you just tell us about the care that you provide and maybe some common reasons that men come in to see you?
So I'm a general urologist, so I'll see anything from patients with kidney stones, bladder problems, prostate problems, and really anything in the urologic spectrum that we can help with.
And what do you tell those patients who might be a little bit hesitant or worried to come in and see you?
I like to start with some of the basics and ask what they want to do for the remainder of their life and how do they want to live that life and what are some things that I can offer them to help them out.
Okay, that's a good place to start. To explore some frequently asked questions and common men's health concerns, we put together a little quiz for you, Dr. Mays.
Wonderful.
Okay, don't be too worried here, but let's go ahead and get started with the very first question. So, this one's true or false? Every man should begin prostate screenings at age 40.
So this is test taking 101. If you see an every and that, you should immediately think false, okay? And this one holds true there. By every man at age 40, there are certain individuals, those who have maybe a genetic predisposition, so that would be those that we consider African American, have a black heritage, or those who have a first degree relative, dad, brother, uncle, with prostate cancer that was diagnosed at an early age. They should talk to their physicians about being screened early. But as a general rule, not every man at age 40.
Okay. All right, next question here. Again, another true or false. If I don't have any symptoms, I don't need to worry about prostate cancer.
Well, I wish that were true. Unfortunately, most gentlemen are diagnosed with prostate cancer without symptoms. If we do diagnose them late because of symptoms, often that's an incurable state. Mm-hmm. And so fortunately, when we diagnose them at an earlier treatable state, that is in hopefully a curable condition.
Okay, all right, that makes sense. Our next question, this one's changing. This one's multiple choice. Men should talk to their doctor when A, they can't find the dairy section at the grocery store, B, they have a flat tire, C, they burn the pizza in the oven, or D, they begin to experience any concerning symptoms or changes in their body.
Well, I think I would say all the above.
I agree with you.
Yeah, and I make pizzas on the side, so I love that. I'm probably less good with a flat tire than, I always know where the dairy section is, but D is if they have any concerning symptoms or changes in their body. You know, common one is blood. If you see blood as a guy in a place that it shouldn't be, seek medical care.
Okay, good rule of thumb. All Our next question. Men who have an enlarged prostate, A, need to learn how to knit, B, need to run 20 miles a day, C, should subscribe to a new magazine, or D, have many treatment options available to them.
Well, I love it. Yeah, D is definitely the right answer. Although I'm trying to learn to crochet here in the near future. Long story. But yeah, definitely D. There's so many options when it comes to enlarged prostate. It's always a late stage if someone gets to the emergency department and a catheter has to be inserted or anything else. We want to get them way before that happens. So if they're going to the bathroom multiple times during the night, more frequent stops on the golf course or anything else, they should think, hey, I should seek help on this.
Okay, good advice. Our next question here. Blank raises your odds of developing prostate cancer to 1 in 3. A, dancing like nobody is watching. B, telling bad jokes. C, drinking wheatgrass. Or D, having a dad, brother, or son who was diagnosed with prostate cancer.
Well, this is the easiest one yet. So it's definitely D. If you have a first-degree relative with prostate cancer, unfortunately, that really speaks to the genetics that you are a part of there, and it really raises the risks of you developing prostate cancer.
Okay. Next one here. Blank are 74% more likely to be diagnosed with prostate cancer and 2.4 times more likely to die as a result. A, a squad of influencers. B, a flutter of butterflies. C, a prickle of hedgehogs. Or D, African American men.
I have yet to deal with a hedgehog, although I do know someone that owns a hedgehog. That's kind of fun. But it's definitely African American men and anybody that we would, classify as black. So if they came from the Caribbean or other lands as well, unfortunately for them in their genetic makeup to have a higher preponderance of prostate cancer.
Okay. Our next question here. Blank can reduce your risk of developing prostate cancer. A, eating a healthy diet. B, maintaining a healthy weight. C, staying physically active. Or D, all of the above.
Yeah, this is the old doctor answer everybody loves hearing. Try and do all the above, and it's tough, but it's true when it comes to prostate cancer and overall well-being. Study after study that we do does show maintaining all those things contributes to better health outcomes in the setting of prostate cancer.
Dr. Mays, these were all really good points of advice that you gave us during the game, so thanks for playing.
Oh, my pleasure.
Okay, so is there anything else that maybe men should know about or you hear about often when you see patients?
Well, one thing that is sometimes awkward to have occur and even more awkward to bring up to a healthcare professional. But if there are any troubles with intimacy, certainly you can bring it up to me and I can help you in that regard. But the greater aspect there, it's also a precursor to more pressing medical needs such as heart attacks and other things. So if there's any trouble in that realm, say something to your medical professional. We're here to help.
All right, Dr. Mays, thanks so much for being with us.
Pleasure being here.
Next, we're going to watch a few videos that highlight some common health topics, and we would like your reaction.
Perfect.
All right, let's take a look at the first one.
Rob and I both, we turned 45 this year, and part of being this age is getting a colonoscopy. It's a simple step that could literally, and I mean literally, save your life.
Perfect. They got the age correct. So that's really important. So recently there were changes in the colon cancer screening guidelines. They dropped the age of screening from age 50 for routine screening down to 45. There's been a trend towards colon cancer becoming more prevalent in the younger population, hence the change. So screenings are important. The only way to really protect yourself is to stick and stay up to date with them.
Great recommendations there. All right, our next video is here.
All right, here we go. 12 pounds, 15 ounces, nearly 13 pounds of poutine. Challenge starts in 5, 4, 3, 2, 1, and start.
Carb overload right there. So I mean, thinking of that, it makes me think of, our obesity epidemic that we have here in the United States. Food's readily available, and oftentimes, our social activities surround food. but being mindful of what you're consuming. If you're going out to eat, tend to have a lot more salt, calorie content, and knowing what you're putting in your body. Because like I said earlier, I mean, a lot of what we deal with in the outpatient setting is chronic diseases that are oftentimes related to your weight.
All right, let's take a look at our next one here.
I'm sure most people know what snoring is.
Yep.
And oftentimes that is a big warning sign that you might have underlying sleep apnea. Now, there's two forms of sleep apnea. There's central sleep apnea and there's obstructive sleep apnea. Obstructive sleep apnea is the more common form of it, oftentimes related to weight. Weight is a big risk factor. Snoring, but there's also, if you stop breathing for small periods of time during sleep, apnea is another big risk. So if you don't have anybody that you live with that can alert you to these risks or signs, other symptoms can be waking up feeling tired, like you haven't slept well, waking up with a morning headache, or getting tired sooner in the day, like in the afternoon, having a hard time staying awake. Very important to make sure you're being treated if you have sleep apnea. Typically involves a CPAP or BiPAP machine that you wear at night to maintain the patency of your airway.
All right, our next one here.
So exercise, yeah, that's a challenge, especially when people are busy.
Yep.
It tends to be the thing that most people will put off. But the American Heart Association recommends about 30 minutes a day of activity that elevates your heart rate, ideally 5 days a week. And if you do that, it can really help kind of keep you at that normal BMI, normal weight, but also it can help prevent other diseases from happening.
I think that maybe also when it comes to being honest with your provider, do you feel that sometimes we're not being as honest as we could be with our doctors?
Yeah, I mean, I can't read my patients' minds, so being honest, I'm not here to judge. I see everything. I mean, I see everything in a matter of one day, and so nothing surprises me.
Better to be honest. All right, let's take a look at our last video.
I'm lucky that my health is a choice. And while I may not be that super fit 17-year-old anymore, I can choose to be a healthier version of me at any age. I have a lot of living to do and a lot of reason to do it as well as I can. So while I'm never going to be an Olympic rower like Adam Creek or a master chef like Ned Bell, and I may not do marathons like Alec, I can still do the things that work for me. So to answer the question, what kind of changes do I have to make to be healthier? Turns out a lot of little ones is a great place to start.
If you want to make a change, you got to start somewhere. And baby steps, small changes are a great place to start. You can tend to put things off, say you're going to do it the next day, and then the next day leads to next week, and the next week leads to next month, and before you know it, you never started to take any of the steps to change. But little changes over time, especially with diet, exercise, can really play a big role to prevent chronic disease and keep you healthy.
All right, Dr. Hetzel, thanks so much for going through those videos with us and for all the information you shared.
Yeah, thank you.
This Men's Health Month, we encourage all men to prioritize their health. Scheduling an annual wellness visit is easy. Simply log in to My ThedaCare and select Schedule an Appointment. We'll see you again soon. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.